Antitheilerial drugs. Outline. What is theileriosis? Antitheilerial drugs, tetracyclines, and hydroxynotoquinones. What is theileriosis? Theileriosis is a global tick-borne disease. The disease is caused by the hemoparasites Theileria annulata, which is transmitted by the tick vector. Tetracyclines. Tetracyclines can be used to treat Theileria infections in cattle, but are less effective and must be given in large doses early in the infection and used for longer periods of treatment. First is OXYTETRACYCLINES. OXYTETRACYCLINES inhibit cell growth by inhibition translation. The binding is reversible in nature. OXYTETRACYCLINE is lipophilic and can easily pass through the cell membrane or passively diffuses through porine channels in the bacterial membrane. Next is Rowley tetracyclines. Rowley tetracyclines passively diffuses through porine channels in the bacterial membrane. And lastly, long-acting tetracycline. Doxycycline inhibit translation by binding to the 16S rRNA portion of the ribosome, preventing binding of tRNA to the RNA that is bacterial ribosomal subunit, which is necessary for the delivery of amino acids for protein synthesis. Previously used for treatment and immunization of agents infection caused by T. parva and T. annulata. Hydroxynotoquinones.
MENOCTONE. MENOCTONE is a potent liver stage antimalarial with corresponding erythrocytic stage efficacy. This drug is an effective treatment against Theileria parva, a parasitic protozoan that causes East Coast fever in cattle. Its mode of action consists of collapsing the mitochondrial membrane, potential and disrupting pyrimidine biosynthesis, leading to parasite death. ATAVAQUONE. It is thought to work via inhibition of electron transport at the mitochondrial BC1 complex because cross-resistance often develops between ATAVAQUONE and decoquinate. PARVAQUONE and BUPARVAQUONE. BUPARVAQUONE resistance appears to be associated with parasites mutations. Its mode of action is thus likely to be similar to that of the antimalarial drug ATAVAQUONE. HALOFUGINONE. Effectiveness of this drug can be observed at the early stages of infection. It is a schizonthicidal drug which produces mild diarrhea at therapeutic doses and toxic at doses more than 3 mg per kilogram. Mode of action is unknown. However, the effectiveness of this drug can be observed at the early stages of infection. It is a schizonthicidal drug which produces mild diarrhea at therapeutic doses and toxic at doses more than 3 mg per kilo. And that's all for antimalarial drugs. Thank you.